Hey y'all, it's me, your girl, Stephia. Listen, y'all, I'm looking crazy right now because I'm just getting out of physical therapy, and I wanted to just touch base with folks because the one thing that in situations where you've had injuries or something's going on, that, again, injury, like my shoulder, I have tendinopathy or whatever that is, tendonitis pretty much. And I was suffering serious stabbing pains for like 2-3 months, what have you. I went and had MRIs done. And the first thing the doctor normally asks, or normally in a situation like that, is that they can give you cortisone shot, to kind of relieve the pain. There's some side effects with cortisone shots. I was doing some research, but I'm not one who likes to take shots if I can avoid them. Although I've thought about it because the pain was pretty intense. But the one thing is, what I would recommend is always ask your doctor if there's the ability to do physical therapy, and that your insurance covers it. Most insurances don't want you to, most insurances really look for you to do physical therapy anyway. But anyway, I say this to say, the physical therapy that I've received probably for the past, I want to say I had physical therapy twice a week for the past, I want to say about 4 weeks. I go back to the doctor next week. I'm actually going to ask him to continue to physical therapy because I know his recommendation is, if I'm still kind of feeling pain, is probably to get a cortisone shot. And what I would say is that my pain has obviously subsided quite a bit since therapy. And, I feel that physical therapy has helped me tremendously. And you have to do the work, obviously, at home as well. But I say this to say is a lot of people sometimes take the first option of, get a cortisone shot and, you'll be fine for, whatever. And usually cortisone shots, a lot of people take them like once a year or once every couple years or 6 months, or depending on the pain that you have. But again, my recommendation for folks is do the work. Again, I could have easily just said, give me the cortisone shot because I was in that much pain. But I opted for physical therapy first to see how things would go. And the pain has subsided quite a bit. I do have still soreness and things of that nature. And there's some days are good days, some bad days. But all in all, I have to say the improvement of my rotation, my ability to lift my arm better, all was a result of physical therapy. So again, cortisone shot, yeah, it's great, might be good for a while. Again, there are side effects, always research that. But to anyone who has had an injury, shoulder, knee, ankle, whatever have you, I've had a couple injuries in my lifetime. Physical therapy, I would recommend, is the way to go, so that you do it, heal naturally, and not with any medication. And it also teaches you how to manage the pain as well, stretching, things of that nature. So cortisone shots doesn't give you that, right? It doesn't train you how to deal with your pain or deal with, the movement, things of that nature. So again, my recommendation for y'all is definitely do physical therapy. I'm going to be asking for them to continue my physical therapy for a couple more weeks, because I feel with a couple more weeks, I'll be in a better position and feel much better. So with that said, that's my advice. This is your girl, Stephia. Don't get the cortisone shot. Do physical therapy, y'all. All right? With that said, love y'all. Have a blessed evening. I'm just leaving my physical therapy, heading back home, and I'll be talking to y'all soon. Peace.